Hi, this is Eddie Lugo with the Overton Clinic. Today I want to talk to you about headaches and migraines. And I say headaches and migraines because very often they're confused as the same thing. They're actually two separate things that very often happen at the same time. So let's talk about headaches first. Headaches are where you feel pain around your neck and your cranium, maybe even from your jaw. They can radiate up into the head, and often the jaw issue will be perceived as a kind of headache. Headaches very often are caused by trigger points. A trigger point is where you have a tight spot in a muscle, let's say this muscle called masseter, and when you press on that muscle, you'll feel a radiating pain into the ear or into the temples or around the eyes. Well, when that muscle gets really, really tight, it'll radiate pain somewhere else, and that's the trigger point referral. So the trigger point is a spot in the muscle, the referral is the referred pain, where you feel pain somewhere else. Well, most headaches actually are referred pain from jaw and neck muscles. A really good example of this is if someone gets headaches very often, they'll ask people to rub their shoulders. Why rub your shoulders if your head hurts? Somehow that makes it feel better. So upper trap has trigger points that refer to very common headaches around the ear and around the eye. And people will even often say, I have a headache that goes like this around the back of my head. I know immediately that's a trigger point from upper trap. So that's why it feels nice to have the shoulders rubbed when you have a headache. So as a neurosomatic therapist, I measure the posture of the patient. I see if the shoulders are high or low. I see if the head is tilting or rotating. And by measuring those different postural positions, it tells me which muscles are going to be short, tight, concentric. Very likely, those are the muscles that are going to be causing headaches. I also talk to the patient about bad habits like leaning forward when using a computer or slumping back when using a computer or driving with one arm, all kinds of things that people do commonly that actually are responsible for the headaches because it causes spasms in the shoulders and the neck muscles. Now, migraines often happen with headaches. They're related, but they're not the same thing. So there are different causes for migraines. I want to talk mostly about cranial hypertension. So if there's something going on with your neck, your heart is pumping blood into your cranium, so the volume of blood in your cranium is increasing, and it could be that the blood is not able to come out at the same rate. So there's some reason, like maybe C1, C2 is turned or shearing, it's in the wrong position. Maybe there's something going on with your cranium. Something is stopping that blood from coming out of your brain. So what happens is the volume of blood keeps growing and growing and growing until finally you have so much blood in your brain, it's called cranial hypertension, that the volume actually starts to press on different parts of your brain. Now you have nausea, now you have light sensitivity, now you have the halo, now you have sound sensitivity. Your brain is not it's not working correctly because there's literal pressure on different parts of your brain. So what do we do for those migraines? We work on C1, C2, we work on the cranium primarily to allow that natural blood flow to happen so that then the pressure on the brain starts to reduce. We ask important questions like, do you feel those migraines when you wake up in the morning? That's a different structure than if it's better when you lay down or it's worse when you stand up. So we ask all those important questions to help us figure out exactly what the issue is. Once we treat for migraines and the headaches that very often come with it, we educate the patient. Probably the most important thing we do, we educate the patient so that they can do whatever they need to do to not get those headaches, not get those migraines again. Part of it has to do with breathing.